All right. Welcome everybody to Grand Rounds. Dr. Zeleski, do you think we should get started?
Yeah, that'd be great.
Okay, I will go ahead and introduce our speaker today. Dr. Zeleski received her Bachelor of Art from UC Berkeley in theater. 10 years later, she returned to academia and ultimately received her MD from Tulane University School of Medicine. She trained as a resident and worked as faculty at Tulane, moving to Boise this year. She is honored to be working with faculty and residents with the University of Washington in Boise. She's equally pleased to be serving the veteran population at the Boise VA. Her interests are in resident education and conceptualization of illness and health and psychiatry, and the subsequent organizational and explanatory models that serve those concepts. Without further ado, Dr. Zeleski.
Thank you. Thank you for that introduction. Okay, let me share my screen. Okay, super. Thank you all for coming. Today, I would like to talk about affective neuroscience, a subject very dear to my heart. See, I do have nothing to disclose. So today we'll talk about Jack Panksepp and his research into affect. So I'm going to introduce his affective taxonomy. I'm going to talk about the clinical implications that may come from that, and hopefully it'll be a bit of a discussion. I'm a clinician, obviously, right? I'm not really an affective neuroscientist or even an expert in neuroscience, but I have been using this model clinically for the past 5 years, essentially through my training. And I'm inspired to share as affective neuroscience. It's very foundational to my clinical practice. I use the model constantly. And I thought it would be nice to be able to talk about it amongst peers. So let me sort of introduce him for those who are not familiar with him. I became familiar with him in 2012, which is when he published this book, The Archaeology of Mind. And I read the book, and this was far before my training. And in the book, he lays out a functional model for emotion. He describes how the emotions operate in our psyche. And I started to work with it first on a personal level. I'm sort of observing in myself and others how what he described lived in the world. And then as I became a psychiatrist, I started using it clinically. And I really think it does a great service to us because it takes all these different permutations of emotions that we have. We have many words for many different emotions, and I represented these in this picture with all the sort of different colors of crayons, and he pulls out the basic colors. And he does this by looking at emotion in animals, where the emotions are essentially simpler, easier to observe, because they're less disrupted by the cortical inhibitions and learnings that are so sophisticated in human beings. And of course, I couldn't possibly guess what model of emotion or theory of emotion anyone in the audience is using, if any at all. Actually, I remember in my training, things like this were very rarely discussed. And surprising to me that we didn't talk about emotion, but we often didn't share different theories of emotion. But I find having a model very clarifying. So I'm hoping we can use this Grand Rounds to do a little bit of that today. And just talk about emotion and how it works into our practice. So a little bit about Panksepp himself. So he was born in Estonia. He moved to the US when he was young. And he actually, really wanted to research emotion in animals, but was discouraged because it was sort of taboo to talk about animals having emotions. He did ultimately study circuits that he considered to be related to the affect And he used electrodes and lesioning and pharmacology in animals to do that. And he did coin this term, affective neuroscience. Unfortunately, he died in 2017. So the idea of animals having emotions is very powerful because it definitely suggests a function. So this would be for our survival as a species. That's why, you know, an emotion would have a benefit in that regard. And that would be as opposed to, say, like a meta-phenomenon, saying, oh, you know, humans, we have so much brain, we have so much, all of these sort of cognitive elaborations, and that's why we have emotions. So that's sort of maybe the opposing viewpoint there. But this concept that animals could have emotions brings us to this sort of functional place. What is the function of these emotions? So let's jump into Panksepp's premise just a little bit more. So his basic premise was that mammals and birds have a primary process emotional system, and that functions to drive locomotive behavior. And by primary process, he means it's not a learned process, it comes inbuilt. And if you look here at the structure of the nervous system, we see that it's locomotive. You know, if we put the head back on the body, which, you know, with our specializations, we sort of separate them, but if we put it back on, we see that the nervous system is actually largely locomotive. And really, with the function of the nervous system being to respond to stimulus in real time, that often does mean moving, doing something, behavior, right? Behavioral health. So the basic affective circuits that Panksepp found are the following: seeking, rage, fear, lust, panic, grief, care, and play. And he uses caps to identify that he's talking about a circuit rather than an experience. And that's his convention that he's always used. And he says that these were the ones he could find. He's not saying that there's not any others, but this is just, with his research, what he was able to come up with. Before we proceed, I do want to just review some neuroanatomy, some facts that I think will be important reference points as we go, especially for trainees or people who haven't been thinking about this lately. So I made this graphic. It's a little busy, but it has the things that we need in it. So over on the right, I have the layers of the brain. So the medulla, the pons, the midbrain, this is our brainstem. And then the subcortical regions, areas that we're going to talk about today include the thalamus, the amygdala, the stria terminalis, and the hypothalamus, and then the cortex. And I'll just sort of remind us that the cortex is sort of a very thin, 6-layered piece of tissue that goes over the entire brain, and it kind of is, it's almost like it's like one thing. It just happens to spread geographically over the entire brain. It's a continuous piece of tissue that is consistent throughout in its structure, and it is the more recent development in brain. Our lower regions are older, and our upper regions are newer. Likewise, these sort of midline systems, these subcortical midline systems are older systems. Those include the midbrain, the hypothalamus, and the thalamus. And they are connected, of course, to the cortical zones, but this area is often correlated with visceral body representations, this older area versus this cortical area. So let's kind of go through the circuits and the locomotive patterns that they're related to. So seeking. This circuit is a circuit that when it was activated, Panksepp noticed that the behaviors included approach, engagement, poking, probing, and inquisitiveness. And here we'll watch this little GIF of this ferret. Look at her go. She investigates and probes, finds her way to something interesting. And this circuit, seeking, is a very important circuit. It's involved with all of the rest. So as you can imagine, if we have a good feeling and a bad feeling, we need some sort of other sort of emotional valence to make us want to seek the good and seek relief from the bad. So seeking operates on a sort of a different axis from our other positive and negative emotions. And in that way, it's very fundamental. And dysfunctions of the system would have a really profound impact on our mental health. We can see that on our examples here. So addiction, you know, obviously looking for the substance or the activity, and many of our addiction specialist peers will say, oh yes, you know, it's not just the person wants to, you know, they want to get the effect of the drug, but they also spend a lot of time thinking about getting it and going on, you know, this sort of activation to go get it. And that in and of itself has its own pleasurable quality to it. Additionally, it's schizophrenia. It's thought that there is a seeking component here. Sometimes it's referred to as salience networks in schizophrenia, but just the looking for something where it is not. So the over-interpretation, the over-attention, the increased salience to maybe mundane activities. And then also in ADHD, seeking new stimulus. And Panksepp felt that ADHD also was very much connected to play. And I'm sure you're picking up on this theme already, that dopamine is a big part of this circuit. So going back to this graphic, we'll see here that the ventral tegmental area is where this circuit, it actually emanates from. So we know that our dopamine projections come from the ventral tegmental area, and this is the circuit that when activated will cause those seeking behaviors. And it goes through to the subcortical and the cortical areas. Okay, so the next circuit is rage. So when the rage circuit's activated, the organism will propel the body forward and bite, scratch, and pound with extremities. But I don't have a GIF for this because it's actually pretty disturbing to watch an animal in rage, but I will give an example to be demonstrative. This is from the book Deep Survival, written by Lawrence Gonzalez. And this is an account from his interview with Aaron Ralston, who is an outdoorsman who was featured in this movie, 127 Hours. And this is after he got his hand trapped under a boulder when he was alone in the wilderness. When his hand was crushed, Aaron's immediate response was reflexive, an ancient pathway in the brain, which scientists call the rage pathway, connects several areas to produce what neuroscientists call affective attack. When you attack, you automatically fight, scream, and bite. All mammals are born with this response. You don't have to learn it. The response is so powerful that it can be overwhelming. It is, after all, meant to free you from the grip of a predator. To Aaron's brain, then the rock was the predator. So when the rock landed on his hand, Aaron at first had no ability to control his rage response. He screamed, grimaced, and attacked the rock, trying to yank his hand free from it and slamming his shoulder against it. He was injuring himself further. But then he did something that is unique in the animal kingdom. He used his frontal lobes. So like I promised, this circuit goes through the periaqueductal brain, not the ventral tegmental area. So we're looking at it sort of a different pathway. And then through to the thalamus, hypothalamus, amygdala, and the other subcortical areas. The periaqueductal gray is essential here. Like if this is lesioned, then the actual affect doesn't produce itself. And I want to take this opportunity to read this quote from Panksepp's book as a case in point for how this works across all the affects. So he says, because anger and hatred are the ways that rage unfolds within our cognitions, it is often hard to keep these interactive concepts distinct in our everyday language. This highlights an important fact for all primary process emotions. We have many emotional terms that are cognitive elaborations built upon and out of the neural energies of our basic emotions. And the image of the mask here is to suggest the way that the cortex can be a mask which obscures the primary process that's going on underneath. So that there's a rage response to a threat may be obscured as we sort of ruminate on our frustrations and our angers. So the next circuit I'd like to talk about is fear. So the locomotion here is actually immobility and tension, but sometimes there is a chaotic flight, but you have to add the seeking circuit, like we're trying to relieve this painful tension, so we're going to seek to find safety. Again, the amygdala and the hypothalamus, and the ventricular areas involving the periaqueductal gray. So this is very close to the rage circuit. So that's why we have this conflagration of flight and fight. They're tightly linked. And actually, we don't experience much fear beyond startle in everyday life. We could postulate, though, that trauma does come from people who've had a real fear experience and the way that that impacts them. I don't have a GIF for this one either. It's partly because there's an immobility or the creature's running away, so it's kind of hard to capture. So I'm going to tell a story to be demonstrative here. So this on the right, here's a locust. When I encountered a locust, it was somewhere between the length of my palm and the full length of my hand. So they can be quite large. And when I encountered one, I was in my New York City apartment, and it was actually hiding under a piece of furniture. And I was talking to my roommate, and it just out of the blue let out the most terrible hissing sound I've ever heard. And I had the strangest experience for me at this time, which is that I froze from head to toe. And even after the locust flew out and we knew what it was, and we understood it wasn't going to hurt me, every time it hissed, my musculature would just freeze. It took a bit of coaching from my roommate telling me, just think about, it's just the sound it makes, it's not going to hurt you, for me to be able to kind of move through this hissing and help my roommate get the locust out of the apartment. And it was a very powerful experience, the way that I had never heard this sound before, but that something deep inside of me had this immediate effective response. And I never forgot that, and have referenced that a lot when thinking about emotions over the years. An important distinction that Panksepp brings up regarding fear and anxiety is the following. Not every form of anxiety emerges from the fear system. We use the word anxiety to several contexts, but we now know that separation anxiety is a very different process in the brain. For example, the panic grief system is probably more important for the often intense feelings of social insecurity. So I think this becomes very clinically relevant as we try to understand and make distinctions. The patient brings the language they're familiar with, but we can have some biological distinctions here if we're familiar with affective neuroscience. His next circuit is lust, courting behavior, sexual behavior. Here we have the peacock, which is our familiar sort of symbol of courting and showing off and that kind of thing. I'm not going to linger here too long, except to say that there's this evidence of like a sexual dimorphism at the site of the hypothalamus here and in the bed nucleus of the stria terminalis. And so in general, of course, we know there's these two sort of subspecialties of species in humans and animals and birds, with a more nurturing subspecialist and a more aggressive subspecialist. Of course, on the individual level, this can vary, but just in general, there is a sexual dimorphism here. And oxytocin mediates the nurturing behaviors, and vasopressin mediates the aggressive behaviors. And presumably the evolution had us subspecialize, because if these two are in the same organism, they may be somewhat at loggerheads. So we could presume that that was necessary on some level. The next circuit is panic grief. And the movements here are crying, trying to reunite, and ultimately sometimes despairing postures. And if you imagine a young animal separated from its mother, what better way than to cry to help her find where you are? Now, of course, that crying needs to be somewhat instinctual. You're a little small animal, so there needs to be some sort of reason to cry out. And here is where I think we stumble onto the most clinically powerful of all the circuits, because it is this deep psychic pain that prompts the cry that breaks us. The pain of separation is so intense, I think of it almost like a hot stove. So as soon as we touch it, we just want to get rid of it as fast as we can. And even though it facilitates this really important attachment, it sets us up for pain throughout our life, especially if we don't know how to handle it. The neurobiology here is distress calls being linked to opiates and oxytocin. So when there's a decline in the opiate, the endogenous opioid, and oxytocin, the distress calls start to emanate. There's drive in the panic grief circuit, which is the periaqueductal gray, again, dorsomedial thalamus, and then up to these cortical areas, the anterior cingulate, which if you study affective neuroscience, you'll find comes up a lot, and the basal forebrain, which is also in that area. It also activates the HPA axis, which is implicated in depression. That's pretty well understood. And it's linked to the effective response to physical pain, which is also in the periaqueductal gray. So the psychic pain of grief and the physical pain are pretty closely linked. They seem to be somewhat related to each other. So as I sort of suggested with the activation of the HPA axis, if chronically activated, we will stop seeking. And Panksepp says in one of his papers, in some, as Bowlby, John Bowlby of attachment theory, originally conjectured, depression arises from sustained separation distress that is eventually followed by chronic depressive despair. Affective neuroscience research has provided abundant data on the brain mechanisms of separation distress, and hence the protest mechanisms that promote depression by gradually diminishing seeking that presages depressive despair. So kind of a sequence of events here. So I'd like to press on to our final two circuits. So the first is care. So the action here is to just envelop a loved one. That's sort of to get closer and have that physical connection. And when you add seeking to this, this also means like going out and making a nest and bringing food and all of those nurturing components. So we see here in our human dog interaction that the opioid and oxytocin mediate the benefits here. This is why everyone likes it. We are, as I said, activating seeking when we're doing these more elaborate care nurturing activities. And sort of, there's a component of distress here related to the distress calls themselves, right? So the distress calls from the small creatures will get a heightened maternal response for care, and that's located in the bed nucleus of the stria terminalis. Panksepp makes an obvious statement, something I'm sure we all could understand, is not psychotherapy care writ large? And our final basic affective circuit is play. There's our cute little GIF of this interspecies playfulness, although the puppies seem a little confused about what's going on. But yeah, animals play. And I think one way this is elaborated in adults is in this sort of laughter is the best medicine. sort of axiom, something that we all can sort of understand, because it releases all of these great endogenous chemicals. The circuit actually runs similar to seeking, although Panksepp had a hard time really characterizing the circuit. That he felt it was the newest and the most difficult to characterize, but it is not strictly through this periaqueductal braid like some of the other circuits. It uses dopamine, opioids, and endocannabinoids. They seemed all to be involved. But he did think this is a primary process affect because play is completely conserved in animals that are decorticate. So even without a cortex, this is a completely conserved function. And it's not totally clear what its evolutionary purpose is, although we could sort of understand, you're going to get some coordination. There are certain like necessary activities that you could learn to do by playing as a child. And there does seem to be some benefits to cortical control, like you learn cortical control by playing, because you kind of have to trade off and who wins and loses and not overpower your playmates and that kind of thing. Playful medicine. Panksepp asks, how can we consider or how can we counter disorders characterized by negative affects with our increasing knowledge of positive affective systems? For instance, we can envision many new ways to use the positive aspects of seeking and play to counteract the negative effects of depression and anxiety disorders. So a sort of hint at what our clinical implications could be. So here we've taken our messy crayon box or our throw it against the wall list of emotional words, and we found some basic colors. This graphic here is from the book I showed you earlier, The Archaeology of Mind. And here he's got these primary processes, these affective circuits we've talked about. This secondary level involves our cognitive elaborations and the learning, right? So we learn, there's certain things we learn, and they kind of stand in for some of these more instinctual patterns that we might take. And then on a tertiary level, our cortex and neocortex can participate in emotional life in this very sort of different kind of way where we name the feelings and we, sort of observe them from a distance and that kind of thing. So I'd like to take a pause here before we go into how this could affect and be involved in the human experience. I'd like to open it up for some questions or discussion, or if anyone takes issue with what Panksepp has done or his premise, we could talk about that for a minute. But I'd like to, before we do that, just sort of try to summarize what I think some of these implications are for us, which is that in the older parts of the brain, there is an activation that happens, and there's this full body engagement, potentially that can be felt, and it can come from a very small or slight modern stimulus, but there is this activation and an urge to act because of this primary process. So I personally experience this as like a physical tension. So like I can relieve the tension by doing the action, or if I wait it out, it'll just, and like don't pay too much attention to it, it'll kind of fade away on its own. But if I experience too much activation in too short of a time, I can become quite tense, and it might be hard to release that tension. And I think that the experience, I've had 10 years to sort of play with this in my personal life, and the only way to take this PowerPoint from just another idea that's being put out there in grand rounds to something that is involved in your life and experiences, to just try to detect those affects in yourself as they're activated and see, basically try it out on yourself, see if what he's saying lines up. I certainly have experienced it that way. I do have like another 15 slides about the human experience, but I do want to just take a moment here and see if there are any questions or any thoughts about his research before we go on. I'm going to have a drink of water while I wait. right then. Oh, do you have a question? That would be wonderful. Does someone have a question? No? Okay. All right. I will go on. So let's talk a little bit about affect in humans and how we try to understand it. So MRI, which is our popular way to understand brain activity, is not the best for emotions. So the big problem is that you have to stay still when you're in the MRI machine. So not only can they only give you a soft enough, like they can't put snakes in the MRI machine because the person will just get up and run away, right? So you can only get like a very sort of just a little bit of enough of an emotional stimulation to like get the cognition going. So you get these large changes in firing picked up in the cortical regions as they try to suppress the movements. And these subcortical regions are firing more slowly. So Panksepp says that the PET scans are better. And they actually show that the cortical regions in intense enough emotions are shut down. So this is a better imaging, less confusing for us. Now I'd like to try to give an example of which I hope will help make this distinction between cognition and primary process clear. So perhaps in this lecture or other lectures or meetings, you found yourself sort of distracted, right? I think that's a pretty universal experience. So one thing that you could do is like reach for your mouse to like multitask, look at your email or check something, or look at your phone to see if it's texted you. And maybe while you're doing that, you're like, oh yeah, you know, this will be really quick, or I just need to do this. This is really important. You might sort of tell yourself that. But I would invite us to reflect on this as a seeking system primary process that starts because our seeking system gets activated to kind of like want to look for something else. And that the cognitive piece where we sort of think about what we're doing and why we're doing it actually kind of comes on a little bit later. So this is why, you know, people might say, oh, you know, like, why are you always picking up your phone? You know, like a partner would be like, you know, you're always on your phone, you're always looking at your phone. And even if you want to stop looking at your phone, you keep finding yourself picking it up because that seeking system has this sort of under the level of consciousness behavioral activation that happens when the affective circuit is running. And this sort of relates to something that could happen in therapy. So here from Panksepp's book, it's difficult to bring the flow of ideas and images associated with emotional arousals explicitly back into phenomenal experiences once passions have subsided. So he's basically saying, like, it's hard to actually remember what happened accurately. This is why reestablishment of primal affects in therapeutic environments can be a rapid pathway to change. Deal directly with the associated ideas and ruminations that spill forth readily, allowing therapists to directly understand maladaptive emotional patterns in action, which provide ideal moments to remold their power. So kind of slowing it down as the affects come over the person, and then they have all the cognitions that come in to try to prevent the affects from causing them to do a behavior that might be inappropriate, and just slowing all of that down and being able to come into contact with the initial affective drive that's causing all the chaos. The point being that these affects are deeply ingrained. They act really fast. They have an evolutionary purpose. So of course, they're very powerful. They're not coming from the cortex. But they can be mediated by the cortex. And they can shut down the cortex at times if intense enough. And so this can create chaos for us as we move in the modern world, because it's a mismatch. It's what evolutionary psychiatrists call a mismatch. Like you're attuned to an environment that we are not in. Other ways that the neocortex can sort of cause issues. So we have this free will illusion, right? That everything we do was our idea first. But really, you know, the neuroscience is a lot of times we're already initiating actions before we've come up with the story for why we're doing them. And we just don't remember that. We have a consciousness bias. We remember the things that we're conscious of, and the things we're most conscious of is our thoughts and our cortical stuff. So all the stuff that is not that, those sort of like verbalizations gets lost. So we don't remember that it happened. Cortex can suppress a lot of that. Okay, so here's some things that I think the way that this has impacted my clinical work. So one thing I do is I consider that all patients might be grieving until I've, proven otherwise in their interview. And I try to ask about threats that they're feeling right now and losses that they have that are involved in their pain and distress, so that I can sort of recognize the non-pathological, I guess, or the natural response that they may be having to the environment. And then I ask questions about how the person is managing their experiences. Like I ask about, what they think will happen if they experience grief, like will it last forever, those kind of things. I talk about the concept of emotional healing from rejection, abuse, and loss. Like you could actually have these things happen to you, have a grief response, and then you could heal from it. So I ask if, what do they think about that idea? And then I ask patients, how do they feel? Like, how does their body feel when they're having emotional responses? That can be very new to people. I mean, I had someone like crying, like kind of sobbing in front of me one time. I asked her, like, what does her body feel? And she said, nothing, I don't feel anything. So that can be surprisingly new to some people to think about things in that way. Education. So a focus on attachment, right? So people don't necessarily know that attachment is really important. We're in a kind of an individualistic society, which has some upsides to it. But as a result, people may not really appreciate how attachment is very helpful to them, right? It's giving people endogenous opioids. It's making them feel good. But people don't know that, right? That's not built-in knowledge. I try to find a way without using too much jargony or, using this particular language to encourage people to play and activate caring and use seeking in a way that's appropriate, like using that excitement of trying to go after something to counteract some of the sadness that comes with the slings and arrows of life. And I teach people about the affective response and interoception so that they can become more aware of what's going on inside of them and possibly diffuse the affective response from all the cognitive stuff, which can be helpful. It's also changed my tone. So I try to model like a curiosity in the tone and the kind of like activating that seeking so that we can activate seeking energy for understanding ourselves. That would be one way to activate that sort of excitement or enthusiasm. I lean on the alliance, and I would insist on the priority of the alliance whenever I have any influence over the systems because of its beneficial effect. And sort of acting as a bridge for someone to be able to appreciate how having these caring relationships is really helpful. And I try to use lightness and laughter, which Marshall Linehan of DBT called a reverence. And that can be sort of challenging because when you're using these emotional systems, you don't want to shut your own cortex down because you want to be able to think. But I think it is really helpful. I mean, that has been my observation. And I specifically worked so that I could train with someone who was very good at a reference. One of my mentors was excellent at this, and I feel I benefited a lot from watching him. Some more specific examples, and there's, I'm sure, tons of them, and if you guys are thinking about some that are not included, I'd love to hear about it. Probably the most obvious one to me is like the borderline personality issue, or emotional dysregulation, which is where a high affective state shuts down the cortical function. So this particular temperament and coping set someone up to experience high affective emotions, shutting down the cortex so that they are not making good decisions every time the circuits are activated. And if you look at DBT and the manual, it's very aligned with affective neuroscience and the things we discussed today. Let's see, also ACT and logotherapy. So these are therapies that activate the seeking network by asking people to focus on their values, and as opposed to worrying about if they feel good or feel bad. So using the activation of that seeking circuit to, I guess, increase resilience and feeling of well-being, because we can't always control whether we're going to feel good or feel bad on that sort of other axis. And that's not to mention Nichiren Buddhism and Stoicism, which use the same sort of philosophy. So here we have a religion, a philosophy, a manualized therapy, a non-manualized therapy. There might be something there. Supportive person-centered therapy is CARE and the Alliance. I mean, in everything we do, we're always talking about using Alliance. So that's very clear. I talked about Linehan's reverence. I don't know if there's other ways. I think maybe when we use like union or parts therapy or imaginative therapy, we're activating this play circuit a little bit. Panksepp felt there was like some sort of connection between the dreamlike circuits. I couldn't fully appreciate or understand where he was going with that. I need to do more reading of his like later work to kind of understand this better. But I think that those imaginative therapies could also be using this network. Emotion-focused therapy is something that works directly with interoceptive awareness of affective response, especially in relationships. It's a really cool therapy. If you haven't heard of it, it's started, I think, with couples, but you can do it with individuals. And then just talking about attachment as a bedrock of mental health, like, so, you know, needing healthy attachments. And I think we all sort of understand this in a lip service way. Yes, healthy attachments are important, but it's not really the center of our focus. You know, it still ends up just sort of in a practical matter kind of being, you know, we do didactic here and a thing there, but are we talking about attachment all the time and those relationships all the time with our patients? Not really. Let's see. So key ideas. Emotions not tameable. You know, our cognition makes us think so because we have some control, but we always will run behind. The emotion will always trigger before we can actually stop it, and then we have to just cope. And even if we become aware of how emotions are a primary process, our patients will not necessarily be aware of this. And so this is a problem. So we don't want to assume that they are aware of this and that, you know, their cognitions could be very tightly fused to their affects, making it very hard for them to know how to act against an effective activation when it's in their best interest, or creating a very confusing, chaotic situation. To reiterate that, I guess affects and cognitions, they work together or against each other, but if they're too conflated, working through is difficult. And when you guide a patient to experience the distinction, it's actually pretty powerful. Let's see. Okay, so in sort of closing up here, I want to show this YouTube video. It's just a minute because I think it encapsulates what I'm trying to get at here better than I could, about this feeling maybe too mechanical for some people. Let's see if I can get this to. I don't know if it will show up or not. All right, it's loading. I'll give it a few seconds to load and drink some water. If it doesn't, I'll try to reenact it for you. Oh, thank goodness.
I don't know if we can hear the audio. I wonder if you need to reshare your screen with the web browser instead of the PowerPoint, maybe?
Or
I don't
under
know.
view options, there might be a share sound option.
Oh, okay.
Or maybe not.
Ethan has a
They
good
would
idea.
share, you have to
Try,
optimize.
let me try to like, because it doesn't make, it's like quiet though.
Okay.
Yeah, it's like a little quiet. How about this?
Inspired deep into our short continuation.
We can hear it now.
You can? Okay.
Survival instinct wired deep into our brains to ensure continuation of species. When early men would visit a watering hole, if they didn't watch their child, they got snatched by a crocodile. Our brains would create a painful but instructional memory, so it would never happen again. This idea of family that is so core with you, that rules your world, is a biological lie. You don't have to accept it. I don't. Did you really think?
All right, so that's it. So essentially the idea is, hold on a second here, that is that this dastardly villain is using affective neuroscience to say that nothing that we feel matters, because it's just this programming to sort of make the species survive, and we shouldn't really care about other people because it's all a lie, right? So I this is an extreme version, but I actually think that this fear does sort of lurk in the water, so to speak, about embracing this kind of approach to emotions. I've heard some of my mentors say, oh, this, that stuff's so mechanical. It kind of doesn't have this like humanness that we want. But I don't think there's any reason to live in a black and white space like that. We don't have to give up a more human way of looking at emotions just because we understand the physics of it or the biochemistry of it. It's not necessary that we do that, but that may have resulted in some of the sort of reluctance to adopt some of this stuff more tightly. So I have this quote here from women who run the Wolves. The balanced valuing of emotion is certainly an act of self-respect. Even raw and messy emotions can be understood as form or light, crackling and bursting with energy. All emotion, even rage, carries knowledge, insight, and what some call enlightenment, a thing not to be rid of so fast, but rather something to climb the mountain for, something to personify via various images in order to learn from, deal with internally, then shape into something useful in the world as a result, or else let it go back down to dust. In cohesive life, emotion is not a standalone item. It is a substance waiting for our transformative efforts. And this is from one of the stories that she tells in that book, The Crescent Moon Bear. And, it's a way that we experience our emotions, but we are not them. The bear is the rage in this story. The emotions are encountered and we learn how to work with them without controlling them. I think the language of wounds and healing, which is sort of may seem a little unscientific, actually helps people provide access to these harder to verbalize affective experiences in their raw form versus the cognitive elaborations that we can get tripped up in. And this kind of work is very powerful when we use these metaphors because it's a way that we can have direct contact with the affect without kind of letting the cognition step aside a little bit. It's probably the most powerful transformative work I've seen and done is in the metaphor space. So in closing, here's a description of the book, The Archaeology of Mind. This is a blurb that I think sums it up well. Jack Panksepp is the most important theorist to mental life I have read since Freud. The impact of his scientific contributions will be felt for decades to come. His findings, so loosely introduced in the accessible book of Lucy Vivian, herald a new golden age. They are almost bound to place 21st century psychiatry on a whole new foundation. In these pages, the supposed chasm between mind and brain disappears before your eyes. The veil is lifted and new vistas appear before you. Those vistas are the future of the science of the mind. And this is Mark Solms. He's a psychoanalyst and a neuropsychologist. And that is the end. I'd love to hear thoughts.
Dr. Zeleski, thank you so much. That was fascinating. And a lot of the kind of cortical versus more kind of old system midbrain stuff made me think about mindfulness and mindfulness exercises and how interwoven mindfulness is in a lot of the surface wave CBT modalities that we have. I'm curious if you know anything more about how mindfulness practices impact these circuits or allow you to look at these circuits, or how it kind of ties in there.
Yeah, thank you for that. Yes, so I think what I've enjoyed about this model is like everything that we do makes sense in this model. So it's very like validating for the model because it doesn't actually take anything off that we do off the table, because theoretically you could say this model is accurate. So the things we do that work would obviously be in concert with this model. On his little graphic that he made for his book, he has mindfulness as one of those tertiary functions in the cortex. And I think the way I think of mindfulness is that it's a training to help someone diffuse the emotional state from the cognitive state. And the most important, in my opinion, mindfulness is the mindfulness of one's own interoceptive experience. So that little twinge of feeling that you have that says, I got to do that. And that you could be mindful enough to feel that feeling and then either not do what you think you got to do, or watch the things that your mind says to deal with that fact that you feel like you got to do it and you can't. So a silly example would be, you know, someone moves my stapler and I get like enraged. I get so angry that I feel violated. And I know that that's ridiculous. I should not be that upset about it. So I tell myself, you know, so I don't do that. And then I think of all these things about the person who moved the stapler and who's right and who's wrong. And I get in all this kind of stuff. So you would like, a mindful person would be able to like see that this, you know, that they had felt, you know, upset about something and that they were having an effective response. They would be able to feel that response. They would be able to accept the response. They'd be mindful of the fact that the response is natural. They're not a bad person, but they would also be mindful of the fact that it's not appropriate. And they would be able to experience it until it sort of diminished. And then they would say, okay, now I can think about what I should do about people moving staplers. Do I need to address it, or do I just, you know, need to get over it? So that's sort of, that would be what a mindful person could do. And actually in clinical practice, it's one of the main objectives I have when I work with the system with people, is training people to be able to have that experience when they have an emotion. So they don't have to kind of go off and do things that are destructive and not beneficial to them in their lives. Thank you. Dr. Hines.
Hey, Dr. Zeleski, that was amazing. I loved seeing the circuits with the neuroscience, with some of the work we do with affective. emotions. Some emotions, as I was hearing you describe the circuits, were not represented. And so I was wondering, like, for example, shame or disgust. And I'm just wondering, maybe those are operational through other existing circuits like fear, that we later put, you see shame or disgust as metaphor, that we put cognition onto. So I just want to hear how he might interpret the multitude of emotional expressions in the circuitry. Thanks.
Yes, thank you for asking that question. So if you go to that graphic again, you'll see there he has like shame and guilt there. I'll talk about disgust in a minute because that's sort of a different subject. So yes, he considers those like an elaboration of the basic circuits. And shame is like one of the, I think is one of the most, relevant clinically, because it's such a difficult emotion to experience. And in his image there, he ties it to grief. And I think that is where it's tied, because it sort of threatens this rejection from the group, right? So there's a threat of loss. So there's sort of, and I do think some of these elaborations are like the fusing, right? It's like colors. You can fuse two colors together. So you can have like a little bit of anger and a little bit of grief and some seeking. You can put it together and then you get this new thing. And so, but the intensity of shame makes me think it's related to grief. I don't recall him specifically stating that, and I think that's in part because he doesn't want to get too far away from his animal research, but he would propose something like that. And he does sort of suggest that we do have to take some sort of, we do have to do some of our own, just drawing our own conclusions. But the thinking of the shame response as a derivative of like the grief response with some other like intensifying components has been helpful for me. When I see someone who's experiencing a lot of shame, I do talk a lot about grief and losses that the person's had, the fears of rejection coming up again, and those kinds of things. And essentially, yeah, you kind of have to play with it a little bit, like pick an emotion word and see if you can kind of figure out what it's connected to. Also in the DBT handbook, Linehan has like done this. She's written like in all of the emotion words under her own sort of category. And I think she just kind of came up with that. So I think we sort of have to do the same. Thank you for that question.
Wonderful presentation. Thank you.
Thank you, Dr. Zeleski.